I welcome you once again to my video channel. As usual, I want to create that necessary symbiotic relationship between the medical laboratory scientists and you the public, so that we can have better health. Health is wealth and knowledge is power, and I'm trying to impart knowledge so that you can have power and wealth. I haven't said that little much. Today's topic, I shall be dwelling on the liver. The liver, knowledge of the liver and laboratory diagnosis. The liver is the biggest organ of the body. It plays almost the most vital role, because we have the brain and other organs too that are very, very vital. But when you are talking of things that come into the body, all the things that come into the body, how they are treated, then you are talking of the liver. The liver takes care of almost everything that comes into our body. The stomach is more of the first part, just like the first mechanism, the skin, the mouth. But where it gets into all the cells of the body, it is the duty of the liver. The liver is more of the portal of entry into the bloodstream of everything, both our food, our drugs, our poison, toxins. So it performs all this function of making sure that the things that enter into the bloodstreams are detoxified. They are now entering at the minutest form, where it can be very useful to even up to the brain. So the blood can flow to every cell and they can receive all their nutrients in perfect. And the ones that are supposed to go out as wastes, it advances them to the large intestine, to the rectum, and also to the kidney. So you can see the vital role. But how do we have this organ that plays that vital role? There are certain things that we need to do to put our liver in a very healthy situation. These days you hear people talking about detoxification, because when you take some harmful things, alcohol is too much. When it's too much, it's very harmful to the liver, because it creates that liver problem, when it manifests later as liver cirrhosis, finally leading to the cancer or even death of the individual. But the alcohol intake can be moderated. So the same thing, the cigarettes. There are other things that you may need to take. It has been proven, which as we go along, I will expose you to more. Like the coffee. Coffee is a very good drink. Amongst the beverages, coffee helps the liver. Scientific studies have proven it. Among up to 70% of those studied who took this coffee regularly are found to have a very healthy liver. There are things that we take also, very oily things that affects our liver. Because when you take in oil, the liver really emulsify it and brings it down to the level that it can enter the blood without doing much harm. But in itself, it damages the liver. When we are obese, the liver itself has problem with obesity, because all the things that you are taking in is going into the liver. The liver has a share of it, and the liver cells are now more or less becoming a fatty liver. And what happens? You experience fatty liver disease. Alcoholic liver, may be called non-fatty liver disease, which every of these things lead eventually to liver cirrhosis, because they damage the liver. The other aspect are viruses. Viruses, we have heard of hepatitis viruses, hepatitis A, B, C, D. Call them. They are listed in that level, and they all affect. The most dangerous and commonly known is the hepatitis B and C. They could be sexually transmitted and through the blood transfusion. Hepatitis C, yes, especially. Hepatitis A could be through fecal routes, and you now have these viruses causing hepatitis in you. Hepatitis is the name that you give to all the liver damage, because it is the inflammation of the liver. Both alcohol, fatty liver disease, and hepatitis, all of them inflame the liver, so they all damage the liver. But in the beginning, it is not very obvious. You do not see it because you continue to live healthy. You think, some may even think they are carriers when they are detected to harbor the viruses. But like I'm saying, it is only the laboratory that can really help. But as we go along, I will expose you to the laboratory aspect, how the laboratory can help even differentiate the different liver and the stages of your liver, because when it has gotten to cirrhosis, liver cirrhosis level, the damage is irreparable. But before it gets there, there are things you can do. People sell supplements, they talk of detoxification of the liver and stuff like that. But what you can do, I will expose you more to it. But for the time being, let us subscribe, let us click the like button, let us do the needful, so that more genuine and cogent points, more knowledge is imparted from me to you, more about health is really done, so that our health is surely our wealth, and the knowledge imparted is now the power we have. So the more knowledge I impart, the more healthy we become, and the wealthier we are. So as I move into the next place, where I shall be going more into the laboratory aspect and other facts that you may need to know, which I have not mentioned, just continue to subscribe. Listen to the end. Thank you. The topic of discussion is knowledge of liver health, laboratory diagnosis. The function of the liver is paramount. It produces bile for the breakdown and absorption of fats. It produces albumin, very necessary for the maintenance of water and to prevent edema. It also is necessary for blood clotting. It stores glucose as glycogen, the excess glucose in the body, and it is involved in the absorption of monosaccharides. It is involved in the regulation of blood clotting. It prevents jaundice by conjugating bilirubin. It converts ammonia to urea in protein metabolism. It helps in fighting infection through the development of immune factors and removal of bacteria from the bloodstream. It helps in the elimination of chemical waste. That is what I explained, that everything that goes in through the mouth has to be filtered, has to be detoxified by the liver before it gets into the bloodstream, that it is now distributed to all the cells of the body. So you can see the role of the liver is very important in making sure that toxin in the environment and certain drugs that we even take, that they are not injurious to the cells of the body. So it takes the damage, and that's why the liver damage is very important for us to talk. The liver itself can always regenerate itself, but when it has been seriously damaged, especially when it gets to liver cirrhosis, there is no way it can be reversed. WHO on liver problems. The hepatitis is an inflammation of the liver that is caused by a variety of infectious viruses, type hepatitis virus A, B, C, D, and E.
In particular, type B and C are the one that cause liver cirrhosis, liver cancers, and viral hepatitis related death. An estimated 354 million people worldwide live with hepatitis B or C, and for most testing and treatment remain beyond reach. That is because its majority are in underdeveloped world. WHO strategy is to reduce the hepatitis ratio by 90% and death by 65% between 2016 and 2030. How far they have gone? Well, it's now another case of study. The findings from the public med publication. In Western countries and some regions of China, the prevalence of non-alcoholic fatty liver diseases is 1.1 to 5% and 15 to 39% respectively. Detoxing from alcohol or drug involves removing toxic substances from the body. That's why you keep hearing to detoxify. This is very necessary because when the liver is progressively being damaged and you detoxify, you will probably allow it to regenerate. But where it has reached the critical point of liver cirrhosis, there is no reverse. Causes of fatty liver diseases can be understood when you take too much high calories. You end up being obese, diabetic, or have high triglycerides. Liver problem prevention. Coffee has been found to be very helpful. The researchers have found that it has antioxidative, anti-inflammatory, and antifibrotic effects, and it also prevents its chemopreventive effect against the starting of cancer, that's hepatocarcinogenesis. It's also a study of interest by Shahu Gem and his co-workers. Experimental studies also show that coffee consumption reduces fast accumulation and collagen deposition in the liver. So you can imagine where you overeat, instead of that high calories becoming more fat. It looks as if the coffee has a kind of effect on these excess calories. Animals and in vitro studies have also been helpful in confirming coffee as being very useful in detoxification. Increased consumption of green tea. Green tea is also another one that helps to reduce the destruction of these liver cells. Laboratory diagnosis is that area of great concern to the medical laboratory scientists and should be of concern to the public. Why? It is very useful in monitoring the damages done to the liver. The liver, when we take drugs, like I said, even drugs that we drink ordinarily, some of them have effect on the liver, the hepatocells, the liver cells, and in so doing, they make the liver dysfunctional. That is, it will not be able to perform the function of detoxification, which would not allow the cells in the surrounding to be damaged. But when the liver is continually damaged and is not monitored, then it develops to liver cirrhosis, liver cancers, and finally death. But the lab diagnosis, if you use it to monitor your health, it is a very useful tool. The most important one is the one that is accumulated mainly in liver damage. That is the jaundice. You find that when that is a serious liver disease, because the liver is supposed to remove this bilirubin. The bilirubin is what now appears and is now referred to as jaundice. The yellowish of the eye or bluish green that you see on the nails and co, especially even in neonates, children that are just being given birth to and they are exposed, they now develop this reaction. And at times hemolytic diseases could also cause excess breakdown of the red blood cells. So the impact of the hemoglobin will produce so much bilirubin, and the liver will be overwhelmed. But the liver normally will conjugate bilirubin and pass it out through the urine, the kidney, or they pass it out in urine. In stool. So the one in stool is called stachybilin. The one in urine is called urobilinogen, oxidized to urobilin. These are the ways the liver do not allow bilirubin to really have great effects. Like I said, the liver is very protective of all the cells of the body. So the laboratory diagnosis tests whether the liver is still performing well by checking for the serum or plasma bilirubin, checking for the direct, which is the conjugated or indirect. By the time you add alcohol, the indirect becomes direct, more or less, and then the total bilirubin is checked to know whether it has risen above the normal level. So the calculation of the absorbance will give one the amount of bilirubin. High result is expected in excess breakdown of red cells, hemolytic jaundice, like I mentioned. Hepatitis caused by viruses, bacteria, chemical drugs, metabolic disturbance in the liver, common with neonate, effective conjugation, blockade with liver flux. When we talk of liver flux, these are parasites, and the cancer, carcinoma of the liver can also cause that. The other way of helping to know the liver function test, that is, whether the liver is functioning very well, is to also measure the serum albumin. The serum albumin, albumin generally is found in protein. Protein is made up of 60% albumin and 40% globulin. Albumin is produced entirely in the liver. Albumin regulates water entry into the plasma using oncotic pressure to pull water from the interstitial tissue surrounding the vessel. So when the albumin is present, you find that there is no edema. So if the patient is showing edema, then the suspicion is probably a liver problem. You can also ascribe it to a kidney problem or even heart problem. It is necessary for water balance in the blood vessels, or there will be edema, a sign and symptom of liver damage, heart and kidney problem. The albumin being smaller than globulin can relatively pass through the kidney. So when you see high albumin in the urine, then you start suspecting that yes, the kidney is also being damaged, because though smaller, but it is not supposed to come out in larger concentration. So that is another way to check for the liver, whether the liver is still functioning perfectly or not, or probably the albumin is the cause of the edema and it's related to the damage of the liver. There is also the method of using BCG, that is, when you want to really test for this albumin, you use it's an indicator, a kind of an indicator that turns from yellow to blue green when it binds to albumin. Promethylcrystal green, that is the full meaning of BCG. And so when you measure the absorbance, or you use the spectrometer to measure the transmittance, you'll be able to get the concentration of the albumin, and that is also measured to know the damage to the liver. Measurement of serum or plasma alanine aminotransferase, you can call it SGPT, and plasma aspartate aminotransferase, also can be called SGOT. That is what is known for earlier in the days. SGPT, SGOT is an alternative name. These enzymes are concerned with amino acid metabolism. ALT is more specific. So when you see there is a damage of the liver, the ALT is the one that tells you yes, because when you have high number, that is, the concentration is higher than normal, then obviously the liver is damaged. And when the liver is damaged at the early stage, there is that need to make conscious effort to not subject the liver to a serious problem. That is, if it is alcoholic problem, then the patient should be advised to reduce his alcoholic intake. If it's non-alcoholic liver problem, liver disease, then the high calories, fatty foods and co will now be reduced so that the liver will not be subjected to more damages that will lead to liver cirrhosis. And both the ALT and AST are useful for monitoring the effect of therapeutic drug on the liver. Like I said, the drugs that are taken are usually detoxify in the liver. They affect the liver more because the liver takes the shock, and where the drugs are really damaging the liver, there is the need for this monitoring to know. That is, when you monitor the level of damage, you'll be able to know that that drug has really affected the liver so much. So the drug may have to be changed. You now use an alternative drug so that the liver will not be worse off. And where you are trying to probably treat the disease, the various diseases, or bacterial infection, or even HIV itself, or any viral infection, then you do not want to worsen the situation of the liver. That is compounding the problem. The principle of the test of alanine measurement is enzyme act. Generally, we know enzymes act on substrate. The alanine aminotransferase catalyzes the transfer of amino group from alanine to tetrabutyrate, forming pyruvate and glutamine. The pyruvate reacts with the dinitrophenylene hydrazine to form dinitrophenylene hydrazone, which is an alkaline medium, gives red-brown color. It is that which is now measured using the filter of 520 or spectrometer of 505 nanometer wavelength to get the level, the concentration of alanine aminotransferase in the plasma or serum. Once it is too high, then you know there is a damage to the liver cell. The level of the damage you can then monitor, so that if it's becoming too much, then you know how to advise to stop the drug, or the choice is the patient's if the advice is not either. There is also this SGOT-SGPT ratio that has been found to be very useful. That the ratio is significantly elevated in patients with alcoholic hepatitis and cirrhosis. SGPT ratio, once it's greater than 2, is highly suggestive of alcoholic hepatitis and cirrhosis. This was the finding of ONJ and his co-workers, and it's very helpful to diagnose the hepatitis as alcoholic hepatitis. Biopsy also is necessary where you find a situation that parasites, especially liver flukes and other parasites like Entamoeba histolytica, which can cause obstructive jaundice and release this high bilirubin. So the biopsy would reflect other causes. If the picture will show whether it's a fatty liver disease, that is, when you see too much fat cells in the histological tissues you are examining, then the picture is reflective of the kind. It's diagnostic anyway. It's very diagnostic of what is happening to all these liver cells. So the biopsy can also help in telling us that yes, the liver is seriously damaged or is damaged, and there's a need to detoxify and prevent further damage. Other tests could include gamma glutamine transferase, alkaline phosphatase, cholesterol time, and international normalized ratio. These are so far what. Then to treatment, we can talk of vaccines, like I earlier said. Then there are antiviral medications, including even lamivudine for treatment. The hepatitis C, there's no vaccine, so but medicine can cure more than 5% of persons with hepatitis C infection. Hepatitis A virus is most common in low and middle income countries. It is a mild form of hepatitis, and with the majority of people recovering fully and developing immunity to further infection. So like what has been presented so far, just click on the like button. Click, because the more you acquire knowledge on how to really go about monitoring your liver, that is, you want to maintain your liver in top shape, the better one's health. Like I've always said, health is wealth, knowledge is power. When you combine these two, surely you have good reason to continue to thank my presentation. Thank you.